Are you worried about the current so-called measles outbreak?
A lot of people are, and how much it's really just that, an outbreak. It's certainly not an epidemic. I think what people are confusing it with is what's happened in the past in third world countries, because measles there can be a lethal disease.
And also, could blaming it on the non-immunized possibly be a marketing strategy to sell more measles vaccines?
Wouldn't be the first time that Big Pharma has done things like that. And yet, we've got to look at both sides of the story if we want to get this right.
And anti-vaccination is a trigger word with very negative connotations. And there are many assumptions without scientific backup concerning the value of vaccines.
In my opinion, the pediatricians do this a lot. They've got a hardcore, straightforward approach that says, vaccinate or else you're not going to be part of my practice, which is really putting a lot of pressure on people that's unfair.
Well, this is why people need to be prepared to have this discussion with their pediatrician.
Exactly.
Because we really do have the choice whether to get our children vaccinated or not. It's not mandatory.
Right.
And if you have done all your homework and you decide you don't want to do it, you need to be prepared to talk to your doctor about it, because he's or she is really going to pressure you a lot.
Exactly.
There's a lot of promotion to get them or to be shamed.
Right.
You know.
Well, those are techniques that try to get you to do what the doctor feels is right. But you got to look at it this way. Do doctors really do their own original research when it comes to immunizations? I'd say categorically across the board that would be unusual if they did. Most of the time, Vicki, where they get their information is from proclamations from their medical association, certainly from the CDC, and we know you can't trust the CDC because they've got so many conflicts of interest with the pharmaceutical industry. Well, so there's a big problem there.
Well, there's a lot of non-evidence-based faith in the infallibility of vaccination.
Absolutely. So we have to take a look at both sides, because there are two sides of this that are valid.
Well, because of the news media storyline promotions for vaccines, you may be surprised to learn that measles vaccines are not really providing good immunity, because the measles are showing up in heavily vaccinated areas.
Exactly.
So we're going to go over some of the real facts that are being ignored, and this can be a very controversial subject.
Absolutely.
So maybe we should just start out with defining the measles.
Okay, well, it's a childhood illness. It's one of the most contagious illnesses we have on the planet. It starts out like a cold. It's a high fever, runny nose, sore throat, little white spots on the inside of the cheek early in the disease. It's followed by a rash, which lasts maybe up 4, 5, 6 days, something like that initially is on the face and chest, and then it moves to the rest of the body. You're contagious a few days before the rash and a few days after. And usually kids in the United States respond well to their own immune system to provide lifelong immunity, as opposed to the vaccine, which is really debatable.
So what's the difference in getting a vaccine here in the United States as opposed to a third world country?
Right. Well, it does the same thing, but in third world countries, we have a big problem, because there we have living conditions that are not very healthy. There's a lot of malnourishment that's out there. Kids are really low in vitamin A, and we know that vitamin A, actually, if you can give these kids that are malnourished in third world countries enough vitamin A, it cuts mortality by 50%. And mortality might be as high as 10% of all kids, particularly under the age of 5, who come down with measles. So in a third world country, measles is a very serious illness. They have this blindness, they have encephalitis, they have dehydration, they wind up with secondary infections in their ear and in their pneumonias. So something must be done. And when you look at the data, okay, of how serious this illness was in 1980, there were about 2.5 million deaths across the globe from measles every year, most of it in kids, again, under the age of 5. Last year, there were 150,000 deaths in third world countries. So you know that there's been a big change and something has done it. And most likely it's the vaccine and the use of vitamin A.
Well, and also the difference, too, in their living conditions, because many of them, they don't have clean water, and their environment is polluted, and they don't know how to get rid of their waste properly. And
exactly.
Obviously, as with any communicable disease, you need to be able to wash your hands frequently and cover your mouth when you cough. And
there's
all that.
There's a big difference, though, Vicki. In the U.S., we don't have those kinds of conditions. Although giving vitamin A to a kid with measles isn't a bad idea, even if they seem to be well nourished. So we're not talking about the same illness. When you have an illness in third world country, the chances of dying are about 10%. In the U.S., it's rare for somebody to die from it. So we've got a different set of circumstances.
And so, yeah, too, like what's the downside in getting this vaccination? I mean, there are a lot of additives and adjuvants, preservatives and things that are in these vaccines, like mercury and aluminum and formaldehyde. And
those are problems in third world countries as well. But why, in this country, is it even a bigger problem? Basically, it's because in third world countries, there are thousands and thousands of kids that are dying. If a few get autism or they have other problems related to the vaccine, that's not a good thing. And it's not just bad luck. You can predict that that's going to happen, but if you can save 2 million lives a year, you've really got something that's a big advantage. In this country, it's a different story. Here, we don't have a lot of deaths from measles. We don't have a lot of encephalitis or blindness. What we have is a lot of kids that are getting measles and getting well. Then the side effects become a big deal. And that's why we're talking about things like the MMR vaccine, measles, mumps, and rubella, being a potentially dangerous thing to cause autism. And it's in a significant number of kids, according to data from certain sources that I think is fairly reliable.
Well, like what happened in Italy.
Right. Well, there's a political thing. In Italy, there have been 2 cases in the last couple of years of kids who had developed autism from the vaccine, even though their Ministry of Health said that that wasn't something that was associated with the measles, mumps, and rubella vaccine. They said that, but at the same time, in that country, you can appeal what the Ministry of Health does. In this country, you can't. So they appealed the case, and what happened is the courts that were looking at it determined that this was something that was related to the impurities, the mercury and formaldehyde and the other things that are in the vaccine, like aluminum, that caused the problem. So that was big news in Italy, and it was all over the place. But the problem is that in this country, nobody even picked it up. It didn't make it to the U.S. in any way. So it makes you wonder who's doing this, who's regulating what gets in the news and what doesn't. And it makes you almost paranoid to think that, well, maybe it's because that the people who run the news are heavily connected with people who are in the pharmaceutical industry and there are big bucks there, and maybe some conflicts of interest in this country that don't exist in Europe.
Well, also in the year 2000, there was it showed a big decline. There was a study that showed a big decline in 1940 in infectious diseases, and that was before there were many vaccines or even antibiotics.
That's
so
right.
They were on the down. What do you call that? A downswing.
On the downswing, but there's a reason for that, and that's because we're making progress with nutrition and with health conditions, with sewage, and with other kinds of problems that we face that are not a problem today. So there have been major changes, but how much of that is related to the vaccine from 1940 to 1980, I don't know. But from 1980 to the present time, I would give the vaccine some credit. So in a third world country, I wouldn't be opposed to immunizing, even though I don't think that's the best solution. The best solution is to what?
Live a healthy lifestyle.
And fix the conditions that are causing an unhealthy lifestyle.
Okay.
So we have to feed these kids, and we have to clean up the environment so that there's not toxic pollution, and then they'll be like here in the U.S. That's the real solution.
Okay, now the other thing you were saying was that if somebody got the measles, that a good thing would be to take vitamin A.
Absolutely.
And also there would be vitamin C and vitamin D.
Yeah, well.
Would be healthy things to do. Because I think we should talk about if somebody gets it, what they can do, because if they decide not to do immunizations, there's a possibility too.
Well, if there's an epidemic of any kind, I think beefing up your vitamin D level makes a lot of sense, because we know that low levels of vitamin D harshly affect our immune system in a very significant way. And when you're in a third world country, even though you get plenty of sunlight to make vitamin D, you don't have the precursors of the vitamin D nucleus to be able to make it with just sunlight alone. So we have to do something in that setting to be smart about how we're going to inexpensively manage to keep this disease to a minimum.
Okay, and the other thing that we said at the beginning was that even people that are vaccinated do get the measles.
Oh, for sure. I mean, you look at some of the big epidemics out that have happened in the last 25, 30 years. A lot of them are occurring, if you want to call them epidemics, I'd call them outbreaks, because they're not thousands and thousands of people. They're more like hundreds of kids that are getting it at the most. That happens when you have a natural up and down kind of cycling of the illness, just as you do with polio or influenza. Every decade or two, there's a rise and a fall that comes by itself. And that's what's happening in states that have been reported to have outbreaks of measles, and 98% of the kids are already immunized. So you have to realize that the vaccine isn't infallible. In fact, it may not be working very well. That's a big issue.
Also, let's talk about what herd immunity is.
Well, that's what people are always talking about when they're saying, well, it's important to immunize your kids for the benefit of the rest of the kids in the community. And what it means is that if everybody's immunized against measles, then the chances of getting measles in that group is diminished substantially. That just makes common sense. But what I just said is that these outbreaks are occurring in communities where 98 or 99% of the kids have been immunized, so it doesn't tell you anything more than what we have as a vaccine that doesn't work that well in this country in that setting.
Well, if you have a compromised immune system, many times it's recommended that you get a vaccination.
Mm-hmm.
But on the other hand, if you have a compromised immune system and you're around somebody that's had a live attenuated vaccination, can't you get it from them?
Yeah, you're at risk for developing something. So you talk about the nasal flu vaccine, or you're talking about the measles vaccine, which is a live, or chickenpox, or even some other diseases. You're looking at a high risk for catching the illness that's in the vaccine if your immune system is poor. But also you're in a situation where the immunization, if you take it yourself, is not likely to even work because your immunity is suppressed. So the people who need the immunization the most are the ones it doesn't work on. Interesting paradox.
Ironic. But anyway, before we wrap up, I really want to go over some of the things that the vaccinations can have or as side effects or that they're linked to besides the autism, because we mentioned the autism, but also learning disabilities and neurological damage and eczema and what else?
Oh, that's enough. I mean, you have anaphylactic reactions. There's local reactions.
ADHD.
Yeah, well, maybe. Those are things that are purported to maybe be related.
SIDS, that's another one.
It's implied to be related to that. That's correct.
So you have to decide whether the benefits balance the risks.
So it depends then upon where you live and what your living conditions are like. You live in a third world country, probably a good idea to do the immunization. Live in the United States, I don't think it's been proven that taking the immunization in this setting with small outbreaks is of much value. So I'd have a hard time recommending.